Okay, so today I am here to present my social concern PowerPoint presentation and the topic I chose was eating disorders. So let me go ahead and share my screen really quick. Okay, and let me open my PowerPoint. There it is. Gonna play my PowerPoint from the start. Okay, so like I said, my topic that I chose was about eating disorders. And my name is Jennifer Lugo, and I am presenting for CED 602 with Professor Lourdes Rosales. Okay, I clicked one too far. Okay, so what are eating disorders? So an eating disorder is basically a psychological condition where people start becoming either obsessed with food, their body image, or their weight. And so they turn to unhealthy eating habits because of it. Um, these are disorders that can cause death if they're left untreated. Like any other illness, if any other illness is left untreated, then it can possibly result in death because it's damaging organs, or it's just going to cause long-term health problems later down the road. So eating disorders affect several million people at any given time. Most often, they're women between the ages of 12 and 35, although it can happen at any life stage. Like I said, it's just like a psychological disorder that causes an unhealthy eating. So the main three types of eating disorders consist of anorexia nervosa, bulimia nervosa, and binge eating disorders. So I'm going to give you another definition. So eating disorders are illnesses in which the people experience severe disturbances in their eating behaviors and related thoughts and emotions. So that's basically restating what I said about people and how they come about to having eating disorders. And it's because they're just mentally or emotionally disturbed, and that's what causes them to obsess with their body weight, their body image, or just if they feel insecure about themselves. I feel like a lot of people tend to stop eating or overeat, and then it comes up, basically they throw it up. Okay, so the next slide, if I can get to it, okay, is anorexia nervosa. So anorexia nervosa is diagnosed when patients weigh at least 15% less than the normal healthy weight expected for their height. The hallmarks of anorexia include limited food intake, fear of being fat, and problems with body image or denial of a low body weight. So basically this image that I put on here, I wanted to show this because I feel like people don't really understand when people are going through this type of eating or any type of eating disorder. um I feel like you really just have to see through their lens and not watch from the outside so much, because we can tell somebody, hey, you need to eat, or hey, oh, look at you, you're so skinny. Or sometimes we mess around if we gained weight or just a little weight, or maybe we lost a little weight. They're like, oh, like, why aren't you eating, or why are you overeating? I feel like those comments can really hurt a person. After I researched everything about eating disorders, it can really cause people to have an eating disorder. Just that simple comment that someone makes about, oh, you gained weight, or oh, something like that. Those people can be so insecure and their self-esteem can go so low that they become this person here in the picture. They can be, this person here in the blue with the leggings, and they're just perfectly fine. They're healthy. But then now, because someone made that comment, or now because they're obsessed with their weight or how they look, because of a comment or maybe because of social media. You know, social media, sometimes I feel like they display the ideal body figure, and you know, the ideal body figure is not an hourglass. Not everybody's gonna have an hourglass shaped figure. We're all different shapes and sizes, and that's what makes us all unique and, you know, and beautiful. So yeah, like I said, I just wanted to really show that picture because it's what's basically going on in that person's head. And they're, like I said, they're not fat. They just think they're fat, but they're not. And that's the reflection they're seeing because they're emotionally and psychologically disturbed. Okay. So symptoms that occur later or menstrual periods cease, osteopenia and osteoporosis. So that means just basically thinning of the bones because they're not eating and they're not getting the right nutrients. So they're losing a lot of calcium, and that's what we need to have strong bones. The hair and the nails become brittle, like I said, because of the lack of nutrients. The skin dries and can take on a yellowish cast. They can also suffer from mild anemia and muscles, including the heart muscle, and waste away. They also suffer from severe constipation because, you know, they're not used to food going through them and digesting properly, like, as you know, someone without an eating disorder would. And so they don't have, you know, they don't have regular bowel movements because they're not eating. There's also drop in blood pressure, and they have slowed breathing and pulse rates because they're not eating. It's basically like they're just skin and bone. There's also internal body temperatures that fall, which can cause them to feel like just cold all the time. Even though it's hot outside or anything, they're still gonna feel cold because of how small they are. And then one of the last things that they also suffer from is depression and lethargy. So they're just, you know, they just don't feel like doing anything, and they're probably super sad and tired, but it's all because they feel that because they're not eating, they're just not living life as, you know, I don't want to say a normal person because they are normal people, but they just are not eating correctly. That's their disorder. Basically, they have eating disorders. The next topic I want to talk about through eating disorders, the second eating disorder, was bulimia nervosa. So here, the signs to look for in a person is they can be slightly underweight, or they can even be a normal weight, and or they could be overweight just a little bit, or they can just be like super overweight, which is obese. So these individuals tend to binge eat frequently, like a lot. Often and being binging, sorry, only when they are interrupted by another person, or they fall asleep, or their stomach hurts from being stretched beyond normal capacity because they're eating more than their stomach truly allows. They're just stuffing their face and overeating. And then what they do after they stuff their face and eat everything they want throughout the whole day, they purge it by throwing up, or sometimes they use a laxative. And then this can happen several times a week. And if it doesn't happen, you know, 5 or 6 times out of the week, it can literally happen. There are people that have bulimia nervosa and it's just really bad for them, but they binge eat and purge maybe up to 3 or 4 times a day. And it's really sad to think about, but this is what these eating disorders can cause, especially bulimia nervosa. Okay, and if I can go to the next slide. Okay, so the red flag symptoms is when they are chronically inflamed and they have a sore throat. Their salivary glands in the neck and below the jaw become really swollen. So their cheeks and their and face become really like puffy. So it causes them to suffer to develop a chipmunk looking face. Just, because it's really bad. And then they're basically forcing the food out of them, which it causes everything because we're, and even our eyes sometimes they get red. Sometimes when we throw up, and it's not because we're meaning to, but they're literally forcing their throat, and it's just really bad for them. Their tooth enamel wears off a lot. Their teeth begin also to decay from exposure to stomach acids. So there's also constant vomiting that can cause GERD. And GERD is basically gastroesophageal reflux disorder. So with this disorder, because they're constantly throwing up the food, it's like all the food is hitting the lining of the throat back here and everything's coming up. So then sometimes food comes up without them wanting to, because like the sphincter in the stomach, it's instead of it being like open, like super open, it's like it starts closing and it starts shooting up the food more up to your throat, and it eventually comes out of your mouth. And there's a lot of, I mean, GERD is actually pretty common for anyone to have, but especially with them, it's really bad. Also, they also abuse laxatives, which causes irritation, and then this leads to even more intestinal problems. They also sometimes use diuretics, which are water pills, excuse me, and then they can cause kidney problems. And then they also suffer from severe dehydration from purging of fluids, because it's like if any of us were to go drink a bunch of water and then we were going to go throw it up, like what was the point of us even digesting or drinking that water if we're going to throw it up? And we're going to be super dehydrated because all the water that we just used, we're throwing it back up. Okay, let me go to the next one. So the last eating disorder is binge eating. So basically this occurs typically with binging episodes, and they feel out of control. Like they have no control over this. They don't try to get rid of the food by vomiting how they did in the other eating disorder, or even by using other unsafe practices such as faxing or laxative abuse. They don't do that. So it's not like bulimia nervosa exactly, but it's kind of related. So binge eating disorder involves frequent overeating during a discrete period of time. So this can happen at least once a week for 3 months. So it doesn't necessarily have to happen, 5 or 6 times out of the week, and it doesn't have to happen several times out of the day. It's just something that happens maybe 4 times in a month because it's once a week for 3 months. But it's just where they just overeat. And I mean literally overeat. Like they'll eat something that they probably should eat in maybe 2 or 3 days, they'll eat it in 1 day. And they just feel like they have no control over it. They just eat and eat and eat until they can't anymore. And then the symptoms to watch for here for binge eating disorders. So number 1 is eating more rapidly than normal. So if they're just eating like if they've never eaten in their life, basically, to give you a better picture, that's how fast they eat. They eat until they feel uncomfortably full, like literally they don't feel good because they just stuff their face so much. Number 3 is eating large amounts of food when not feeling physically hungry. So they're just not hungry, but they're just eating because, like I said, it's out of their control and they're just eating to eat because they're having an episode. And then the 4th thing to watch out for is eating alone, because they decide to eat alone because they're embarrassed of how much they are eating. So it's kind of like, they don't want to be disturbed by someone and be like, oh, why are you eating so much? They rather, keep to themselves and be isolated. And that's another thing. They just become isolated. So the last thing to watch for is feeling disgusted with oneself. And then they feel depressed or very guilty afterwards. They have an extreme abundance of food. They're going to feel like, oh, I shouldn't have done that. And then they're going to feel depressed and guilty. but they did it because they were having an episode. And like I said, it's out of their control. It just happens. So there is treatment for eating disorders. So basically, you would assist patients with a healthy weight plan, a healthy weight gain plan, excuse me. You can also send those patients or those individuals, I'm sorry, to somebody, within psychotherapy. They can also be provided with prescription medications if needed after being evaluated by a psychotherapist. And then, of course, there's nutritional management and nutritional counseling, which I think all of these things are very important to get someone back on track just by simply assisting patients to, gain weight in a healthy manner. I think that's a great step. I think psychotherapy is very, very much needed to help them deal with their, emotionally and disturbed thoughts about, obsessing with their weight, their body image, or just how they look overall. And if medication is needed, then so be it. If they just need this, that little boost with that medication, then that's what they need. And then nutritional management and nutritional counseling, of course, I think this is also very important because they'll learn to eat healthy, they'll learn to eat properly and to not undereat or overeat. So I think those are all those factors are very important. And then the resources for help. So NEDA stands for National Eating Disorders Association. And then they have a toll-free phone number. So it is 1-800-931-2237. Their hours are 9 a.m. to 9 p.m. And then Monday through Thursday, 9 a.m. to 5 p.m. Eastern time, and Fridays as well. And then what I like about them is that they have a 24/7 crisis support. So they can simply pick up their phone and text NEDA to this number here, to 741-741, and they'll receive some sort of assistance through whatever crisis they're going through at the moment. There's also ANAD, so National Association of Anorexia Nervosa and Related Disorders. So they can also visit this site, or they can also visit BEDA, which is Binge Eating Disorder Association. So those are just some resources that they can look out for if you know anyone, or if somebody is personally going through this crisis, then they can go ahead and reach out to them and they'll definitely help them. Like I said, that concludes my presentation, but eating disorders can really, really affect someone tremendously, and it can lead to death if it's not addressed at the correct time. So, and please, next time, that someone makes a comment about somebody gaining weight, or just how anything related to like weight or weight loss, or just anything within their body, if it's not something positive, let's just not say it, because even me, including myself, I think I learned a lot from just researching eating disorders, because comments can really, really, really affect someone in a major way. So that's basically it. Thank you. And okay, bye.